my particular interest is in vision therapy in pediatrics, but we'll see people for pretty much everything, so for regular eye exams even, or glaucoma or cataracts or eye infections, whatever. So.
Do you see patients who have like concussions and strokes and stuff like that?
Yeah, we see those too. Yeah. So, we get referrals from the hospital and chiropractors and even lawyers sometimes. For head injuries. Yeah. So we see a lot of those folks. So we definitely there's a lot of stuff we can evaluate, and even besides therapy, there's certain things we can do to help people with head injuries, special prisms and their glasses and things like that.
Yeah. And what kind of success rate would you say you have in the practice with vision therapy?
I don't really measure success rate. Everybody improves to some degree. Right. So then you get some kind of miraculous cases, and then you get ones where they get some good improvement, and then you get some where you wish you got a little more. But everybody's brain's different and responds to therapy differently and different speeds, so but everybody does make progress for sure to some degree.
What's your favorite part about vision therapy, or what's your favorite? Why do you think that kind of called to you?
Yeah, well, the thing that really makes my day, is when you finish up with them and the parents tell you that their reading's starting to take off, and they're basically like their lives have changed. It just feels great, to be able to do that, for sure. Yeah, it's so that's the big thing for me, is just that I really like about it, is that you're doing something, you're improving people, you're not just managing a condition that's never going to go away, you're actually increasing their skill levels and their confidence.
So what kind of people would refer to your practice, or to a vision therapy practice, or your practice specifically? So you mentioned chiropractors, you mentioned sometimes lawyers, hospitals. Are there any other, who are the kinds of people that you would want to, that are like, potentially referring to you, or,
other eye care providers do, and also teachers, occupational therapists, physical therapists. So actually we get probably the most referrals from those kind of practitioners, because they're spending time with the patient enough to notice that they're having some vision problems, that like maybe a primary care physician might not really pick up on, because they're only spending 15 minutes with them or something like that. So the people that are seeing them on a regular basis kind of start noticing signs and recommend an evaluation for vision therapy. Yeah.
What would you say to a parent who has not seen anything particularly wrong in their kid, but maybe their kid hasn't done a comprehensive eye exam, or hasn't considered looking at more like a developmental or functional vision exam? Do you have a message? Is that important? Should it just wait until they see something wrong, or is it something that every parent should do?
I think a lot of parents get kind of a false sense of security because they've had their vision screening done at school or at the doctor's office, and that doesn't really check for that's more just checking for clarity of eyesight, and not for a actual like vision problem. As far as how well they're using both eyes together, focusing their eyes, moving their eyes, that sort of thing. So it's definitely good to get checked out. I think it's a squeaky wheel gets the grease sort of thing. So the kids that are really falling behind tend to, we see them for these kind of evaluations. But it's worth, I think for everybody it's worth looking into, because if there's some area that you can improve on, and improve your efficiency and your skill set, then that's, might as well make everything as good as you can get it, if you're motivated.
What would I expect at taking my kid in for an eye exam?
Mm-hmm.
What should I expect, or what are you looking at a child's first eye exam with you? let's say at age 5?
For a first eye exam, I mean, obviously you have to check just the basics at first, so, I mean, they do need to be able to see clearly, they need to be able to have that 20/20 vision, and then, and then also checking their eye health and everything like that. I mean, eye health conditions are pretty rare in kids, but they do pop up, once in a while, so it's good to check for that stuff.
Right.
And once you know that that's like the bottom of the pyramid,
Sure.
And I think most kids, when they get an eye exam, that's what, that's kind of like, that's what gets checked at most eye care places, which is good, then they get the glasses they need or whatever, but then beyond that, if they do, usually as I'm doing the exam, I'll do some little screening kind of eye movement tests, and also kind of check how well their eyes are working together, how good at depth perception, their level of kind of depth perception or 3D vision, and also how well they're focusing their eyes or adjusting their focus for kind of near point tasks and that sort of thing. So you'll start with that, and then if things look a little off, then we'll go deeper and check, do some other tests if it seems necessary. So some kids, everything looks awesome and good. We don't need to do all, get too in depth with it. Just do a basic eye exam. But
a lot of people have, or there are companies out there that have advertisements for 2 pairs of glasses and an eye exam for $40. Right? Your practice has a lot of technology in it, a lot of advanced services. So maybe speak to what are some of the things that you've done to invest in that side of the business, the training of the staff, let's say, or the technology that you put in to make to make the quality of care the focus and not necessarily the best the drive to
Right.
just doing cheaper everything.
Well, yeah, I mean, I think really the big thing, I mean, you can talk about all the technology and stuff, but really the big thing is the time that you spend with patients.
Sure.
So, I mean, it's neat if you have all this cool technology, but then you spend 5 or 10 minutes doing your exam. I mean, how well are you going to get to know
Right.
how this person's visual system is working in that amount of time? So I pretty much do the whole exam myself. I don't really have a technician that does a lot of it for me, so I get to know kids better. And then as far as technology goes, I mean, a lot of it again is skill set. I mean, you can. I mean, we do have some neat technology, but I mean, my most important piece of equipment is this thing called a retinoscope. That's a very basic thing, but I can't really do it. I can check so much in terms of how a kid is focusing their eyes without them having to tell me about it just by looking with a light.
Sure.
So just having that kind of it's kind of an art form to be good at that sort of thing. So I kind of pride myself in my retinoscopy skills, but we also have some different technology. Like we have a special autorefractor. And most practices have an autorefractor, but we have a special one where you look through an open window, which gives you a lot more accurate results for a child. And you can also assess how they focus with that, how they focus their eyes. And then then we have a lot of technology that I've developed, for vision therapy, like vision therapy software and the eye chart and stuff like that. And then we have most of the stuff that a typical practice has, different tests for glaucoma or taking photographs of the back of the eye and that sort of stuff as well.